Parkview Medical Center is a 350-bed facility located in Pueblo, Colorado. Parkview provides a full range of healthcare services, including the region's most experienced certified Level 2 trauma center and the region's first certified stroke center.
Well, what led to this decision to bring in an outside consultant was the fact that we were already working very diligently down in the ER, and while we were seeing some tremendous gains and some tremendous improvements, we weren't seeing the consistency and the sustainability that we were looking for down there.
What I was thinking when I heard that Renoir was coming into the emergency room was what a great opportunity for the ER to look at all of its processes and try and make those improvements that we've always wanted to do, and now had some expertise in to help us kind of organize our thoughts.
We want them to see where the weaknesses are, and then around those weaknesses, which we call opportunities, develop detailed plans as to how they're going to improve them. It all comes down to management of change and ensuring that we over-communicate, we work with the staff to let them know what's going on, what's going to be happening, and involve them in the whole process of what's going to be changing.
We spent a lot of time just digging and trying to find data and then looking at that data to find out what was happening in the ER. What was our average length of stay? How long did it take for a test to go from the time we drew the blood to the time it was actually resulted? And then we were also trying to figure out who was responsible for each role.
I remember sitting with the lab director in the initial meetings with Renoir and basically pointing at each other across the table that you're the problem, you're the problem. Renoir was able to map and do dialos of, from blood draw, from bedside, all the way to results getting to the physician on the computer and figuring out where the delays are.
The improvements and the gains that Parkview has had based on this project being done were remarkable. The 33% improvement for the lab, the ED as a whole hitting their throughput targets and going beyond those targets, really the end result justifies anything it took to get to this point.
The culture has really shifted. It's changed from a very anecdotal kind of culture-based environment to a data-driven environment, and so this will never go away.
The fact that we reduced the length of stay in the emergency room by 1 hour has a fairly significant impact, because most of the people that see our hospital sooner or later, most of them come to the emergency room. If they see the hospital as efficient in that area, then they're likely to choose the hospital for inpatient work also, and for other services like MRIs and CT scans, physical therapy. We have a lot of different services here.
When you think about where we are today and where we started, the return on investment's been great. And in talking to both our Chief Financial Officer and our Chief Operating Officer, where we are today is where we hope to be.
Renoir, the capacity to see, the power to change.